Now on the American Health Journal. Obesity is becoming an epidemic in America. For the morbidly obese, bariatric surgery has been successful in helping patients achieve and maintain a healthy weight. As we learned from Dr. David Davtyan of the Beverly Hills Weight Loss Medical Centers, a new laparoscopic procedure promises safe and effective results with less risk of complications.
LapBand was invented in the United States approximately in early 80s, but unfortunately went on ignored for about a decade until in 92 Belgian surgeons first used it to induce weight loss and to try to fight off obesity, which, as you know, is now becoming an epidemic plaguing not only the United States but the entire world. And what it consists of a band which is placed around the stomach, around the upper part of the stomach, to restrict the access of food to the stomach, which is, the band is then connected to a subcutaneous port, which is this part, which is placed under the skin on the anterior abdominal wall, where it is, though not visible, easily palpable. So these two components are connected to each other through a catheter, which you see here, thus enabling the physician to control the size of this band by injecting fluid into this port. The band wraps around the stomach. The outer surface of the band is fairly rigid, but the inner surface is inflatable. By inflating the inner surface, you can reduce the inner diameter and thus make it tighter and tighter, cinch it down around the stomach, creating a very asymmetric hourglass, if you can imagine, where once food fills up the upper part of the hourglass, it takes a long time to empty into the lower part of the stomach, thus taking away the feeling of hunger, controlling, inducing early satiety, and thus inducing weight loss. The nicest thing about the LapBand, it does not involve cutting any vital organ. There is no suturing, there is no stapling, there is no cutting or rearranging of the native God-created normal anatomy. What is nice about the LapBand is that the LapBand involves a small dissection around the stomach. In good hands, LapBand should take 1 hour or less as far as a procedure, and the results are very good. Patients go home either the same evening or the following morning, and they can return to work in 2 to 3 days. Tammy is one of my first patients who has lost 70 pounds by now, and she's going to continue losing weight until she comes close to her ideal body weight, and she's also very happy with those results.
I went into the hospital. I had it done. 2.5 days I was out. I had 3 or 4 more days. I went back to work. Within about a week, 2 weeks, everybody started coming up. My face started getting slender. You could just tell that I was changing. My stomach started going down, and people started noticing that I was losing weight. And they really didn't know how until I started telling them about the surgery.
One of the other advantages of the LapBand, other than it is a reversible procedure with no permanent restructuring of the normal anatomy, is also the fact that it is adjustable. And the adjustments are usually done in the office setting by injecting or withdrawing fluid from the band by accessing it through with a needle through subcutaneous port. By having a band myself, I have perfected the tuning of the band to the maximum where I can predict how much volume of injectate is going to be just the right for this person to control their tightness so that it's good enough, meaning that they're still losing weight, but it's loose enough that they still can enjoy good food.
You're watching the award-winning